Yeah, just a quick review of the back stretcher for lower back pain relief. This is one that I found on Amazon. I think it's one of the cooler ones that I've seen. But there are a lot of different variations of this. This one I kind of like in particular, and I think it is just called the back stretcher for lower back pain relief, if you want to look that up. No, I don't sell these. This is a really good thing to do. Basically, the whole purpose of it is to increase your lumbar mobility because it's stretching. Anytime you stretch something, you make something a little more pliable, and then you get more mobility. So this is mainly for increased mobility. One thing I do like about this one, a few points. This one actually has, it's adjustable. It has 3 levels of arching. And what you do, here's a good picture, you just kind of lay over the back of it, okay? And so it's got these 3 different levels. So if you put it on this first row of notches, this is going to be spread out more and you'll just have a really gradual curve. Then if you put it on the third one, it's really going to arch up. So really you want to start on the lowest setting and just try it for just a couple minutes because, it's kind of like throwing an arch support, under your heel. Some people it's not going to agree with right away. You're going to, because, you start raising up your heel, you could start creating problems with the knee and the hip and even your back. So it's, you don't start with like, a 1/2 inch, shoe insert. You start really gradually and build it up if you need to. That's kind of the idea here. Just start out with the lowest arch, most gradual arch. Try it for a minute or two, then see how you are the next day. And then you can start worrying about, laying on it longer. So I would start on the lowest level of arching, lay on it, for like, even if you can lay on it for 2 or 3 minutes, that's really good. And then you can go to the next level and build up to 2 or 3 minutes and then build up to the next level. It does have a nice cushion here because this is where your vertebrae are going to be. The back part of your vertebrae, the 6 called your spinous processes, that's really the bony things sticking up that you feel. If it's hard plastic, then it's going to be really uncomfortable. So they've added this really cushioned strip, which I like. And this one's really made of a high-tech plastic. It supports up to 400 pounds. Okay, so here again, up to 400 pounds, most people are going to be able to use this thing. Now you can also put this in a chair sideways and use it as kind of a lumbar support. That's just something you can try if you need to. I don't know if that'll necessarily work or not. I've seen some people even try these on their neck, but I think this is mainly for the lower back would work best on. Now, if you do lay on it, you might hear some popping. No need for alarm. It's kind of like when a chiropractor pops your back. What you're doing is you're gapping the facet joints. The facet joints are just the tiny little joints in your back. And when you gap them, it creates a little space, and the little synovial fluid that's in the joint, kind of the bubbles, the gas from that jump out, and that's what the pop is. So basically, in a nutshell, when you hear a pop, you're gapping the joint, and you're stretching the joint capsule, and you're stretching things. So actually, I think the pop is a good thing. You don't have to have a pop in order to stretch things, so let me make that clear. But if you lay backwards on this thing and you hear a couple pops, that's the facet joints. That's just the little tiny joints that connect one vertebrae to another. So yeah, so that's it. You use this mainly to help relax, the muscles, and just kind of stretch out your spine. I think it's a really good tool. The other thing you need to do for low back pain is to make sure you're strengthening your multifidus muscle. If you haven't heard of that, you can check out this book here, Treat Your Own Spinal Stenosis. It'll tell you all about the multifidus muscle. I think there's other resources as well. This one, I think also you can get on Amazon. The multifidus is a muscle, of all the muscles that stabilize your spine, 2/3 of the support of the stability of your spine comes from the multifidus muscle. Now, what they're doing is they're finding that people that name about any back problem, like acute low back pain, chronic low back pain, spinal stenosis, herniated discs, spondylolisthesis, when they go around to sticking that, when they go checking that multifidus muscle out, okay, either like they might just take an MRI, they find the multifidus on one side is smaller than the other. They might find that it's not conducting properly. They might find out it's not as strong as it should be. A lot of problems, just about any problem you can name, I can probably show you a study where they've looked at the multifidus and found that it's not working like it should. So multifidus strengthening is a must. Likewise, they find in randomized controlled trials that if you actually strengthen the multifidus muscle, the back pain goes away. So it's something you need to be doing. This one particular resource, I like this because it's got a variety of multifidus exercises in different positions. So let's say if you're on your hands and knees, you can't do that because your knee hurts. They got other ways to do it. You can do it on your stomach. There's one in sitting. Um, Also, a few other things here. This is program here is a good little program to do. It takes you like less than 10 minutes a day. Some days it's just a few minutes if you just do the stretching. They have a little series of tune-ups, all aimed to increase the function of your back, make your back much stronger, make your back more flexible. They have some stretches in there you may or may not have done, even improving your proprioception. Another thing they're doing is they're getting around to testing people's proprioception, which is your position sense. So like if you close your eyes, you know if your knee is bent or straight, right? Without looking at it, with your eyes closed. That's your proprioception, your position sense. Well, they're finding that people with low back pain can have problems with their proprioception. So you have an exercise for that. Just it kind of covers all the function of your back. Bring this up. As a good resource for multifidus strengthening. But yeah, as far as that's strengthening, this is basically mobility. This is all about increasing range of motion, which can go a long way to taking a bite out of your back pain. So I think it's definitely something to try. So check it out.